Hello, my name is Dr. Kristen Higgins, and I'm a radiation oncologist specializing in thoracic cancers at Winship Cancer Institute of Emory University. That's a really important question for patients and their families. What happens after the consultation with your radiation oncologist, and how does the treatment course progress through the treatment mapping into the daily radiation treatments? So after the consultation, we will typically discuss all of the side effects of radiation, and we sign a consent form authorizing radiation treatment. At that point, we're then able to schedule something called a simulation or a treatment planning session. And those are really synonyms. What we're doing at that session is we are mapping out on your body anatomically where the radiation will be delivered. And what it feels like from a patient point of view is that you're going to go meet your radiation oncologist, and it's going to feel like you're getting a CT scan. You go into a room with a CT scanner. One of the differences is that the bore of the CT scanner is a bit bigger so that you can get into the scanner with your arms maybe above your head, or maybe one arm above your head and the other arm down, or sort of different positions based on what your doctor needs in terms of targeting the tumor appropriately. There may also be treatment accessories that the doctor is going to use to help you get in the optimal position for treatment. Many times for lung cancer, we make a mold, for example, for your body to really support your arms that need to be up above your head during the duration of the treatment. Once we get you into the comfortable treatment position, we then do a CT scan, and we use marks to indicate where the radiation will be delivered on your body. And then those marks are usually stickered on your body. We don't tend to use tattoos much anymore, but there will be marks and stickers on your body on both sides that are used to line your body up with the lasers in the treatment room when radiation is delivered. And after that mapping session, it takes anywhere from 5 to 10 business days to generate the radiation plan. And what's happening behind the scenes is that your physicians are going over all of the diagnostic imaging that you've had, whether it's a PET scan, a CT scan, an MRI, and really trying to figure out where that tumor is on your body anatomically. And they're also trying to avoid the radiation dose to your normal organs that are nearby. For lung cancers, that's your heart, your esophagus, and your normal lung and spinal cord. And we work with a specialized team of physicists and dosimetrists to create a radiation plan that optimally delivers radiation to your tumor, but avoids radiation dose to those important organs that are nearby that we want to keep safe. And it takes about, again, 5 to 10 business days to generate that high quality radiation plan. And there are also some quality assurance steps that happen behind the scenes that makes that process a little bit longer. But what I want to emphasize is that those safety steps are really needed to make sure that every part of the radiation plan is perfect. We even go as far as to test the radiation dose in a water phantom to make sure that the dose is what the treatment planning software system is saying it is. It's just a double check, again, to make sure that the radiation that you're going to get for your treatment is safe and is intended by your physicians and your care team. So that sort of is all happening behind the scenes after your simulation. And then again, about 5 to 10 days later, you'll go in to start the first treatment. The first treatment is usually the longest. You have to get into that proper position. You're going to meet your therapist and the other therapy team, and they'll help you get into the proper position for the radiation treatment. And they'll also take images to make sure that you are aligned properly. And that's where those stickers on your body come into play. And we need those stickers to get you in line with the lasers in the radiation treatment room. And then your treatment is delivered. And typically the treatment times nowadays are very fast. The treatment can be delivered in as short as 5 minutes. I tell most patients that you'll be here for about 20 minutes, and then your treatment will be done and you can go home and you have the rest of your day.